Hi, welcome to CCK Live. Today we're breaking down what veterans can expect at a CMP exam for arthritis. Let's get started.
The first thing that we're going to be breaking down is what arthritis is, and there are a few different types of arthritis that veterans may have.
First, there's degenerative arthritis, also called osteoarthritis, which occurs when cartilage between the joints erodes over time, resulting in joint stiffness, limited mobility, and pain. This type of arthritis usually takes place in weight-bearing joints like the back, hips, and knees.
Next, there's rheumatoid arthritis, which occurs when the immune system malfunctions and attacks the membranes lining your joints, resulting in inflammation, limited motion, stiffness, and pain. Symptoms of both conditions can range from mildly disabling to totally debilitating.
Another form of arthritis many veterans experience is psoriatic arthritis. Psoriatic arthritis is a form of arthritis that affects some people who have psoriasis, which is a skin condition that can cause red patches or scales. Psoriatic arthritis can cause joint pain, stiffness, and swelling, and the joints might also become painful, swollen, or warm to the touch.
And then finally, one other common form of arthritis experienced by veterans can occur in relation to gout, which is a form of inflammatory arthritis that can be very painful. It often causes sudden, intense attacks of joint pain, starting with the big toe and spreading to other joints from there.
Next, we're going to talk about types of service connection and arthritis. So, first, to establish direct service connection for arthritis, veterans have to prove that the condition is linked to an event that occurred during their time in service. In service injuries or overuse of the joints make a veteran more likely to develop arthritis later in life, as this condition tends to progress over time when cartilage continues to wear down.
A doctor can look at a veteran's in service injuries or overuse and determine if there is a causal relationship to their current arthritis.
Veterans can also be eligible for presumptive service connection for both types of arthritis listed above. Under 38 CFR 3.309, arthritis is characterized as a chronic disease, and VA holds that if symptoms appear within 1 year of discharge from military service, to agree that is at least 10% disabling, then a presumption of service connection is going to apply.
This presumption is important as it allows veterans to establish service connection, even if they do not otherwise have medical evidence that links their currently diagnosed arthritis to a particular incident or injury in service. So here, the presumption under 3.309 serves as a shortcut to service connection as long as the condition manifested to a degree of 10% disabling within 1 year of discharge.
Veterans can also receive secondary service connection for arthritis, meaning that another service connected condition caused their arthritis, and arthritis can also be the cause of secondary conditions as well.
And if a veteran is granted service connection for arthritis, they can potentially receive a rating of up to 100%.
So, having gone over that, now we're going to talk about what to expect at your CMP exam for arthritis. So, prior to a CMP exam, the examiner should review your medical history, the claims file, and any pertinent facts regarding your case. The examiner will also look to see if there is an x ray on file that definitively shows the presence of arthritis. Without that x ray, a service connection may be denied.
And once the x ray is confirmed, the most important aspect of the CMP exam for arthritis involves range of motion testing. The examiner will use a device called a goniometer that will be able to test the extension and flexion point of a particular joint.
And based on the limitation of motion that's measured, VA will then determine if service connection is warranted and assign a disability rating in accordance with the rating criteria. It's important to understand that just like with all other CMP exams, the examiner is not the one deciding service connection or a rating. Instead, the examiner is going to be focused on gathering evidence, such as the measurements for your limited range of motion.
It is also important for veterans to be open and honest about the pain and functional limitations they experience because of their arthritis. By telling examiners this information, VA should consider functional loss when assigning a rating. In other words, VA is not only supposed to look at the limitation of motion, but also factors such as instability, stiffness, tenderness, and anything else that impedes your ability to perform daily working movements. Impairments to working movements could be impairments to sitting, standing, walking, running, or other movements, all of which VA should factor in to your rating.
Now, sometimes an examiner will issue an unfavorable CMP exam report, meaning that they've determined that an increase in severity isn't warranted, or maybe that the condition's not related to service, depending on the purpose of the examination. If this happens, there are options to refute the examination. Veterans can submit a statement refuting the exam to VA. They can also dispute the examiner's qualifications for the exam that was performed, or they can submit their own private medical opinion to offset the examiner's opinion.
Additionally, if the VA examiner does not address functional loss and limits their consideration just to the range of motion measurements caused by arthritis, you can argue that the CNP exam is inadequate for rating purposes because, like Bethany mentioned earlier, it's just as important for the examiner to consider the actual functional impact, including limitations on walking, sitting, standing, etc.
So that's all we had for today. We hope you found this helpful to prepare for your next CMP exam for arthritis. Be sure to like this video and subscribe to our channel for the latest VA disability benefits information. Thanks for tuning in.